Hello everyone, my name is Daniela and welcome back to my channel. This episode is for you or for someone you know has been diagnosed with invasive ductal carcinoma HER2 positive, or if you want to know more about this type of breast cancer, you're in the right place. This video is here to educate you on this type of breast cancer. Let's get started with the definition of invasive ductal carcinoma. It is a cancer that starts in the breast milk ducts and spreads to the surrounding breast tissue. It can get into your bloodstream or lymphatic system and spread to other areas of your body. Under a microscope, the tumors do not fit a specific pattern, as they vary in appearance. HER2 positive is the affected human epidermal growth factor receptor, and its role is to regulate cell growth, survival, and differentiation. Therefore, when it's affected, it promotes rapid and uncontrolled cell proliferation. In Canada, breast cancer is one of the most common types of cancer. Canada's incidence rate is higher than the global populations. However, the mortality rate is lower compared to the global populations. Some associated risks for breast cancer include, but are not limited to, the history of breast cancer, inherited genetic mutations, and taking hormone replacement therapy. Some available treatments include targeted therapies and chemotherapy to shrink tumors prior to removal of tumors via surgery. Some latest research done by Excel et al. Was done to find a new best treatment for early stages of this cancer. Their research included an in vitro portion, which is lab using breast cancer tissues, and in vivo portion using mice with breast tumors to investigate the combination of HER2 positive targeted vaccines and simvastatin. The targeted vaccine increases the activation of the immune system, and the simvastatin weakens the cancer cells, giving the doctors an effective and gentle treatment option for this cancer. With that being said, there are also some limitations and gaps in the research that impact how this cancer is treated. There is an incomplete understanding of breast cancer, like the pathways responsible for drug resistance or why the cancer migrates to other parts of the body. There is an incomplete understanding of breast cancer, like the pathways responsible for drug resistance or why the cancer migrates to other parts of the body. This lack of understanding affects on treatments such as antibody-drug coupler drug designs, as these current drugs may not be the best suited for HER2 positive breast cancer. However, improving the antibody binding sites could enhance the removal of these cancer cells. There is also a large gap between drug treatments for this cancer. As mentioned before, the vaccines are good in efficiency, but there needs to be more options for effectively combating these treatments. The literature also suggests combining therapies in future research to focus on multi-targeted drug combinations to improve efficiency of treatment and overcome drug resistance. I want to thank you for listening to this video, and I hope having this information has answered any questions you may have about invasive ductal carcinoma HER2 positive. This has been Daniela, and thank you so much.
Created using Powtoon.